why is cancer bad? You have said that these cells replicate, they're proliferating, becoming many, and they are moving to other tissues to destroy them.
Yes.
So when someone gets cancer, what does it do to them as a person? I've been healthy, I'm walking around and everything, so if cancer happens, what changes in a person's body?
Excellent. That's a good question. So now, every cell in your body has a function, right? It is there to do something for you to survive, in a sense. There is nothing wasted. Now, when you have this uncontrolled or a certain cell changes, it stops doing its function. Number two, it grows uncontrollably. That means it also stops the other cells which are normal around it from doing their function.
Hello guys, Dr. Kendi here and welcome back to My Oral Health Diaries. We started our series on oral cancer. I think last week we just did a short episode on maxillofacial surgery, or let me put it properly, oral and maxillofacial surgery. And we promised that we are going to go through this series concerning oral cancer. Our specialist is still with us and we are truly, truly grateful. I am honestly super humbled to have him on my channel. And I would just like for us guys to use this information to make better decisions with regards to our oral health. We really need to change the oral health care in Kenya. So joining us again is Dr. Kamau, our oral and maxillofacial specialist. And today we're going to begin our discussion on oral cancer. Karibu sana, Daktari.
Thank you very much.
I hope you've been feeling nice. You've become a celebrity.
Oh,
yeah.
How I feel? I don't know. Okay. So.
You haven't become a celebrity yet. Sawa, karibu sana. Thank you so much for joining us again on this week's episode. Yes. And we just want to discuss oral cancer.
Yes.
So maybe we can just start with you explaining to our viewers what oral cancer is. You know, most people don't even know what cancer is. Wanajua tu ni kitu mbaya, but they don't really understand what cancer is. So maybe you can explain to us what it is.
Okay. So when somebody tells about oral cancer, they're telling you about a condition and where it's found. So oral means it's found within the area of the mouth, the lips, the jaws, around the teeth, the tongue, etc. When you talk about cancer, we are basically describing a condition whereby there is uncontrolled, what we call cells. Your body is made up of cells.
Yes.
So there's uncontrolled cell growth. And this uncontrolled cell growth has got the ability to spread to other parts of the body and destroy normal tissue. Right? So inevitably, if it's to do that, it's going to destroy important tissues that help you function. That can inevitably lead to what? To death. That's why cancer, in and of itself, is a very scary condition, right? Wherever you get it. So for oral cancer, we are dealing with all the types of cancers, as a broad term, that can be found within the mouth. All right?
Yes.
So which type of cancers do you have? There are several, but the best way for me to kind of break it down, you've got cells.
Yes.
Cells, not one cell, but you can have many cells, and these different cells perform different functions. So if you've got a group of cells that perform a different function, we call that a tissue.
Yes.
Right? And in the body there are 4 tissues.
Okay.
There is the one like the skin, so that's epithelium.
Okay.
We've got muscle, that's muscle or pulsive tissue. We've got the nerves, like the brain, neural tissue, and then we've got that tissue that connects all of this together, right? Connective tissue. So if these cells, any of these cells of these tissues now change and then get those uncontrolled growth and can disseminate in the body, that's what we call a cancer. So the cancer can be of epithelial tissue for the skin. These are among the most common, the ones that you'll find. So in the oral cavity, in the mouth, the ones of the superficial surface, we call them carcinomas. Those are the most common. We can get of the bone. Bone is a part of connective tissue. So we call those bone cancers or sarcomas. You can get that of other connective tissues like the ones that people might know, the blood system. So those are like leukemias, etc. You can get, for the nerves, you can get cancers of the nerves, etc. Or even cancers of the muscle. So all these tissues, because they exist in the oral cavity, you can get cancers of them. But for us, but now what happens is that the most common oral cancer, the ones that we see, making about 90%, is the one that comes from the superficial surface. So we call those, for the epithelial tissue, so we call that the carcinomas. And since they're the main block, we'll be discussing those ones.
We'll be focusing on that.
Exactly.
Awesome. So we have explained what cancer is broadly from a medical perspective. But maybe, Doc, you can explain to our viewers, why is cancer bad? You have said that these cells replicate, they're proliferating, becoming many, and they are moving to other tissues to destroy them.
Yes.
So when someone gets cancer, what does it do to them as a person? I've been healthy, I'm walking around and everything. So if cancer happens, what changes in a person's body?
Excellent. That's a good question. So now, every cell in your body has a function, right? It is there to do something for you to survive, in a sense. There is nothing wasted. Now, when you have this uncontrolled, or a certain cell changes, it stops doing its function. Number two, it grows uncontrollably. That means it also stops the other cells which are normal around it from doing their function. So let's imagine you got a cancer that proliferates of the jaw. So it will grow, it will be abnormal, so the jaw will expand. What will affect? Maybe you'll not be able to eat. It starts destroying, it destroys the normal tissue, the blood vessels, so you bleed. Aesthetics is bad, especially for you, so you hide yourself there in your room. You can't eat, so you get malnourished. And the upper airway is here where you breathe, so it can even block and stop your breathing. So these are the things so what it does in essence in cancer is stop you from functioning normally and coexisting. Now, even worse is that you might have it in the jaw. But now, strictly cancer is those cells have the ability to detach and spread, for example, to the blood system, to another tissue. Now imagine if it goes to your lungs. So this one is from the mouth. It's from your mouth. It goes into the lungs. The lungs are very important in what you breathe in. So now you get that cancerous cell in the lung. It's still growing uncontrollably. So it's doing what? Destroying the lung tissue that's important for
breathing.
And that is how people now succumb, essentially. So it can go to any part of the human body and destroy those organs. And that is the danger of cancer.
That it affects your normal function. Okay. Is cancer painful? Is oral cancer painful?
Yes. Because again, this cancer is growing uncontrollably and destroying the tissues around. So it's destroying. So once you start destroying, you get like a wound. Number two, you're destroying also the nerves. So you get those wounds festering, get infections. And so one of the critical things that you might get is you can get pain. Sometimes they might even destroy the nerve where you don't even get pain, but you get numbness. So some of the key characteristics of the cancers can present in those forms. Pain initially, and then if it grows beyond and destroys the nerve, you can even get numbness. So there's some key distinct things that we look for that can tell us, we're going from this is something very insidious, something dangerous. Usually other types of growths that are not cancerous do not usually impact or don't present with this. They don't invade and destroy other tissue. They don't attack. They're just docile. They're docile, but they expand, but you still have the nerve function. You may not even have pain. That's an interesting thing, right? So cancer will, in of itself, does present with pain, can present with bleeding because they're affecting the blood vessels. It's an open wound, so there's bleeding. You can get numbness because they can influence the nerves there and destroy them, etc.
Okay. So, Doc, you've mentioned that, yes, we have this benign or non-hazardous swellings or lesions, and then there are these now cancerous lesions that are bad. So what can a patient look at and say, okay, what I have is probably not bad? Like, what are the warning signs for a patient to look out for in the oral cavity or the head and neck region if they probably have a pimple or something? How would I tell that this thing I'm having needs to be checked out?
That's a very good question because, when do you get worried?
Yes, when should I get worried?
In a nutshell, what we advise people is that if you have any swelling, this is in general, anywhere in the part of the body, and this swelling does not disappear. You find that it's there, it's continuing to grow, and it's been there maybe for more than 2 weeks. There's something that has been there that doesn't seem to be improving. Always go and check it out.
Yes.
So when we're talking about oral cancer, 2 ways that it can present. You can either get a wound, right?
Yeah.
For example, on your tongue, etc. So sometimes the wounds can be like, for example, if you bite yourself. So what you'd expect is that you get a wound, if you bite yourself on the tongue or the cheek, you can even see the wound.
Yeah.
But what happens?
It
Within
heals.
it heals within 4 or 3 days. So you don't need to worry.
Mm.
But if you have a wound that doesn't seem to be healing, has got all the symptoms of pain that you'd experience, etc., bleeding, it looks like a wound and is continuing to either increase in size beyond 14 days especially. We usually use like 2 weeks as a cutoff because that becomes a chronic wound.
Okay.
Make sure you go and have it checked. So it can manifest other ways. It doesn't have to be a wound, like an ulcer. It can also be a swelling, a node. So the swellings can be in the mouth, they can be in the neck, etc. So if you also have these swellings that are there, that have been there for a long time, we're not saying it's cancerous, but we're saying please
get it checked.
Get it checked. Yeah.
It's a warning sign.
It is a warning sign. Now, the only way you can actually diagnose it, for us as clinicians, we can have a look and get, we have a high index of suspicion that clinically this looks like this.
Yeah.
But for you to confirm it, you must always have what is known as take part of that tissue and take it to be looked under the microscope in a laboratory for them to confirm the characteristics of cancer. So it is only the laboratory diagnosis that will confirm that you have cancer. So if you have these issues, the best thing to do, number one, go and see your clinician.
Yes.
When the clinician has looked at the lesion and asked you a few questions, because there's some questions that they need to ask, then they can advise you appropriately. One of the things they can tell you, look, it's not healing, you don't know what's going on, it's not looking like it's an infection, so let's take a little bit of that, please, and take it to the lab. Then from the lab, they'll get the answers. And when you get that answer, it gives you now a way forward in terms of how to manage, basically.
Okay. So maybe we are talking about oral cancer and some of us feel like it's very far-fetched. Maybe you can let us know about the prevalence of oral cancer in Kenya. Is it something very common? Do you feel like, are there areas statistically where you'd say this area there's a high prevalence of oral cancer in Kenya? What is happening? What is the situation in Kenya?
Yeah, so what's the situation? Okay, so in general, so we've got cancers. So we've got a population of about 53 million people. So generally, cancers will probably, you get maybe about 50,000, 40 to 50,000 cases, right?
Okay.
Oral cancer itself will make up maybe 4% of those. So in general, it's still among the top 20 of the cancers, right? The top being maybe breast cancer, cervical, the ones that I think are very well known to the public. So in general, you'll probably be thinking of maybe 800 cases per year. But we don't have an exact figure for that. We don't have the proper registry. So some of these things are statisticians know how to correlate with that. So we're saying maybe about 800 per year will be oral cancer. Out of the maybe 40,000 total body cancers that we have in Kenya. So that is kind of the prevalence that we see. So basically, if you're saying like in Kenya, out of every 100,000 people, 4 will have cancer.
That's still high.
That's kind of scary. Yes. So 4 in every, that's called incidence. So 4 in every 100,000 people can get oral cancer. Yes.
Okay. I think an important thing also maybe to put out there for our viewers is the fact that oral cancer maybe has been like said to be the second most common type of malignancy in patients with HIV. Is that something you have seen a lot in patients who are immunocompromised in Kenya? Maybe we would say in Africa because we have the highest burden of the HIV.
Yes.
How would we say we are at a higher risk? A patient who has been diagnosed with HIV, should they be more worried about oral cancer and why?
Yes, definitely. So the way you put it is that for you, in general, your body is able to control these uncontrolled cells that are there. There's something called tumor surveillance and clearing of those cells. What HIV does is it suppresses the immune system, destroys these important cells that are crucial for what? Suppressing the tumors.
Yeah.
So yes, there are some studies that have been done that have shown that have been associated, that we know that when you get HIV, there's a sudden dramatic increase in some certain types of cancers. So the most common one used to be called Kaposi sarcoma.
Yes.
That was well known. They are kind of lymphatic tissue tumors. We call them lymphomas that also increased as we saw HIV going into the population. And oral squamous cell carcinoma also increased. So HIV became now should I say a modifiable factor that increased the incidence or prevalence of oral squamous cell carcinoma. But the mere fact that it reduces or it reduces your immune system. Yeah. So not only will you get cancers, you get a whole lot of other things because of just that reduction in immunity. Okay. So immunosuppression, whether it's HIV or even you who has gotten an organ transplant and you have to suppress your immune system, you will start seeing the emergence of these types of related conditions.
Yeah.
For cancers.
Good. But now, Doc, that you've mentioned about risk factors, maybe we can go into that. What would we like for people to know are the risk factors, you know, either modifiable or the other ones that are not modifiable? What should they avoid? Yeah. Basically.
So this is the thing that you must understand, because we do not want to try and correlate.
Yes.
Cancer has no known cause.
Yes.
Right? Let's just be clear on that. We cannot.
We have to be very clear.
We have to be clear. We can't say, "Oh, I'm doing this; it's going to cause cancer." No.
Yeah.
There is no known cause.
Yes.
But there are risk factors that if you do this, you've got probably a higher chance of getting cancer. But that doesn't mean you will get it. So she mentioned modifiable. Those are things like environment, what you do. Yeah? There are some things that can't be changed. Like for example, your genetic makeup. You might be born with a genetic defect that predisposes you to get cancer. So there are people who have got those genetic defects, right?
Like what now? People would ask, what? Like what?
Because the key thing, you're made of what is known as DNA.
Yes.
So if you have a problem in DNA, for example, repair, then the cell itself, which DNA is a core, will have a problem in its machinery. So probably it cannot be able to control itself. So a defect in the DNA can cause those issues. Yeah. So there's one condition that maybe people can read. It's called Xeroderma Pigment. So the DNA repair mechanism is spoiled.
Is interfered with.
In a sense. So if you go out into the sunlight, your body is able to repair the cells. Your DNA can repair cells. Even if you get sunlight, sunburns, you're able to repair. But in these people,
it's been hot.
It's
been hot.
So you get sunburns, etc. You repair yourself. The tissues are repaired. Those ones that are then like the skin itself will repair itself, etc. Now imagine if you can't repair it itself. Those cells themselves can they get damaged. Then they go into that cycle of maybe uncontrolled cell growth, etc. Then get a cancer. So that's what usually happens. So that is not modifiable.
That you can't. It's genetic.
It's genetic. So you'll see those ones in younger children, so they'll get the cancers in younger children because inherently you'll see them earlier because of a gene-related issue. Then there are those environmental factors that come in. One of them, very famous, is tobacco. Whether you smoke it, whether you use it as pan, which is seen very commonly in Southeast Asia. So they put areca or betel nut, put it in the cheek, etc., and then leave it there. So that is one of the predisposing. Combination with alcohol use can be a modifiable factor.
So when you combine tobacco use and alcohol
use?
Okay.
Of course, there are chemical carcinogens that can be there, maybe certain chemicals in the environment. Asbestos that used to be used for roof tiles, we don't no longer use it, but it used to be a factor. Microbiological carcinogens, let me call it that way. For example, viral infections, very common. The most common one that we know is human papillomavirus. Very common in terms of causing cervical cancer in ladies, but also been noted to bring about oropharyngeal cancers. So you see that all this that you may not be born with, but in the course of life you gain. You either start using tobacco, with alcohol, or with other things, etc. And this now increase your chances of getting cancer. But we're not saying that if you smoke,
you will. But it's a risk factor.
It's a risk factor.
Yeah.
That's important.
Okay.
So those are among the things that can cause or can be attributed. Not can cause. Let me remove the cause.
Can be
a risk factor.
It's a risk factor.
Yeah.
Okay. So I think I will ask you what our viewers maybe are mostly concerned about, especially the young viewers. There's been a lot of discussion going around about shisha.
Okay.
Have you heard about shisha, Doc?
Yes, I think about shisha.
Yeah.
And I think
what do you have to say about shisha?
I mean, it's still related to tobacco. I think with shisha, there are actually no even filters. Whether the filters help or not, I don't think so. What you're doing is exposing the cells of your body to this, maybe the smoke. The smoke, whatever it has, like tobacco, nicotine, has got the carcinogens.
Yes.
So what you're doing is, they call it insulting. It's like insulting. It's like, just keep on slapping.
Yeah.
You've just been slapped. One day you'll react. So that's what happens with the human body. So it's an insult to the tissues, and then sooner or later, the tissues themselves may not be able to repair themselves. And then now they move from now being able to repair to not being able to repair, and then now you go that cycle of going towards what? Development of cancer.
Yeah.
So we actually do have, there can be stages where you can start developing lesions that predispose to cancer. For example, betel nut. Southeast Asians do it a lot. They put the tobacco on the side of the cheek. What happens over a prolonged time, 10, 15 years, you start seeing the cheek change inside the mouth.
Yeah.
It starts changing color, might appear white, might appear red.
Yeah. A lot of discussion we're like, because it's all flavored and everything, that it doesn't cause any damage, but it actually does. It's not a healthy thing per se. It is part of enjoyment and entertainment, but it is good to know that it also may cause some damage. What else would I like to mention? Mira. And I don't know what they call it, mogoka. Is it the same thing? Is it the same
Not
thing?
exactly the same thing.
Very, the same thing.
Very common in the Mount Kenya region.
Yes.
Meru, Embu.
Yeah.
So mogoka and mira, kind of maybe the same plant but different parts of it.
Yeah. Now I'm from there, I'm concerned. But what does mira and mogoka do? Because there's a very high prevalence of oral squamous cell carcinoma there.
Very true. So there is a high incidence in Mount Kenya. So there's been some investigations, for example, what could be the lead cause.
Yes.
But in these areas in the Mount Kenya region, there's a lot of factors that could be there. Could it be the crops, the pesticides that you're using, etc. Is it the behaviors of people? You have people who chew mira, probably also take alcohol and take tobacco.
Yeah.
So there are all
Mostly,
these modifiable risk factors that come in. So you're not sure exactly what causes it. But for sure, within the Mount Kenya region, there's been tending, this is anecdotal, it's not something, tending towards a higher, you see more cases of oropharyngeal cancers coming from there. So cat in of itself it's a chemical, there's a chemical within it which kind of, I think, makes you stay awake and gives you a sense of euphoria kind of thing. So it's addictive. How much of it can be contributed? There have been studies. I think there are studies being undertaken to know that, but because of these other factors that come in, like smoking, can be tricky to try
and go in
and say that this is actually a risk factor because of all these combinations that come in.
Okay.
Yeah.
So maybe lastly, before we finish today's episode, Doc, there's been a lot of use of bleaching products. People want to be lighter and they're bleaching and using all this makeup and stuff. Is there anything that has contributed to with regards to cancer? Has anything changed?
Could it be? Yes,
Could it
maybe
be a
when
risk
you
factor?
it could be a risk factor, especially, the popularity of some of these products means that there might be also what is known as contraband, kind of alternative products that do lighten, because you can actually get a lightening product from a dermatologist for whatever reason. Maybe you have a skin condition that you want sorted.
So you could get a prescription.
You can get a prescription for it, for whatever reason. People generally, we don't advise, I don't know, it's a psychological thing that people, I think, prefer to be lighter. For whatever reason, I do not know.
It's a social thing.
But it has become very popular in some certain settings. So you might find people who may not afford but will seek, I don't know, are they medications or creams?
Those creams, yeah.
And there are people who will manufacture without going through the right process. So whatever they include may not be apt. What are some of those chemicals? Because now they affect the cells within the epithelium, they can be harmful. And the same thing again. If it's causing an insult, you're not sure how these products probably have not been tested over time. You're literally the test subject. And that product itself, or the chemicals within them, nobody knows how they react. A lot of this can lead to you having problems. Skin conditions, chronic skin conditions that can maybe then manifest in a later part as a cancer. So it could lead to especially with uncontrolled use, or should I say, use of these uncontrolled substances. So it could be a risk factor. So you should be very careful when utilizing some of these things. Always seek medical advice.
Okay, before you use them. Would you say age is a risk factor? If I'm younger, is age a risk factor with regards to cancer?
Now with age, all modifiable factors come in. So whenever we talked about oral cancer, the carcinomas, we tended to see them in older people, above 40 and above 50. But because of time and the modifiable risk factors that are there. But that doesn't mean that if you have not done them, you won't get it. You can still be not smoking, not drinking, etc., but you still get a cancer. It can occur. So yes, with age, definitely you see more cancers. For the ones who are modifiable. If it's genetic, you will see them
younger.
Okay. In children, actually.
Yes. All right. So that's it. We've tried to just, pick on the most common risk factors with regards to oral cancer. And I hope it has given us a bit of a picture of what, we are trying to talk about here. We will definitely continue this discussion in part 2, but we'll take a short break during the week as we absorb what we've been discussing. As usual, kindly leave your comments in the comment section. Continue liking, subscribing, and sharing on My Oral Health Diaries. And we're definitely looking forward to part 2. Make sure you don't miss out. Thank you so much for joining us. Sorry, no, tulikuwa tu tuna chat kiasi. Tuko ready?
Yes.
Tuko ready. Ishaanza kwa intense kidogo useme, ala. Chill.